I stopped in today. I was in Calgary this morning. I'm headed to Edmonton, but I wanted to be here with Minister Mandel because today we're announcing our government will expand mental health programs to reach students and youth at schools across the province, modeled on a very, very successful program here in your community.
We had an alarming number of students that committed suicide, so as a community group, we felt something needed to be done. Well, we look at the students that we have a pre-screening test and then we have a post-screening test that the students take a survey. We use the iPads. It's a 50-question survey, so they take those and we compare the post results with the pre-test results to see compare the two of them to see what kind of results the students are feeling in the areas of depression, drug awareness, any of those kinds of things like that, anxiety.
I don't know what to say.
Everyone has like an Instagram, a Tumblr, or any kind of place that has a bunch of like people trying to be like, oh, I'm so perfect or something, kind of like. And it kind of pushed more pressure on teens to be like, oh, I must be like her, I must be like her. But yet society is also contradicting itself, saying you can be unique, be who you want to be. But yet they're saying you need to be perfect. So it definitely adds more pressure because you never know what to be. You never know if you're supposed to be that perfect model girl or if you're supposed to be your unique, weird self.
The one thing that I really liked was the screening, and that was when we did the stuff on the iPads. And I just thought that a lot of kids, including myself, you just give enough information that sometimes you don't give the information as much when you're talking to someone. But I feel like a lot of the kids gave more information when we did the iPad, and I thought that was cool because I think that the teachers that are doing the resiliency deserve to know exactly what's going on and trying to help. And I like how there was a variety of things you could do to help yourself.
Across the 4 sites, it'd be about $5 to $6 million. Suicide's a problem across every province. And across every place in the United States, suicide is, there's nothing more devastating to a family, and we think this will be a great help.
Why did you pick those 4 centers specifically?
Each one had a specific characteristic. The one the rural area just south of Chinook, just south of Red Deer, felt it ties into Red Deer, but it's a rural constituency. Medicine Hat because it's a southeastern area and we haven't been down there, and then Wetaskiwin because that has an Aboriginal component. And the Red Deer Catholic because then it completes the Red Deer package. So when all the information is in, it should give us enough data to make determinations how we can then expand the program. Gradually across the province, it's you have to have the talent to have support systems for it as well. So you just can't open up every door. So it'll take us about 3 or 4 years by the time we get every school across the province involved with it.
Sorry, any teacher or counselor, like definitely talk to them, and also talk to your parents. They can help more than you think that they can. Even if you think that, oh no, they'll just like put it down or say that I don't have it or just a phase, like even so you need to talk to them so that they're at least aware of it in case anything else bad happens. Be like, well, actually in grade 8 you had this, so it kind of relates back and saying, well, we could have caught it earlier. So like talking more about it to your parents and peers and teachers.